Healthcare simulation provides a unique opportunity for learners to interact and care for patients in realistic surroundings. Any level of learner can put their skills and knowledge to practice in a challenging, safe environment. Simulation is supported by adult learning theory, which maintains that participants learn more when they're able to apply their knowledge and problem-solving skills in an environment that most reflects their performance context. In simulation, all members of the healthcare team can care for patients as they would in real life. Simulation requires engaging in a fiction contract. There are unrealistic features of the simulated setting. We try to make the experience as real as possible by having as many of the supplies and equipment you would usually find in your clinical environment. We ask that you meet us halfway and perform as if it were a real patient in a real clinical environment. The more you put into simulation, the better the learning experience. We also recognize that technology isn't perfect. If we encounter a glitch, please do the best you can to continue with the simulation. The embedded simulation person will help guide you if this occurs. We're not trying to trick you or deceive you. Any limitations due to room setup or mannequin capabilities will be clarified by your facilitator or embedded simulation person. We maintain a basic assumption about every learner. We believe that everyone participating in simulation is an intelligent and well-trained individual who cares about their patient, the care they provide, and wants to improve. We recognize that at times we don't act in simulation as we do in actual clinical practice. It's easy to say what should be done when you're observing, but it's sometimes hard to think on your feet during simulation. One of the reasons we do simulation is to help prepare you to think and act on your feet. Generally, our simulations include a pre-briefing, a simulation, and a debriefing session. In immersive simulation, we ask that you assume your typical role in patient care and function within your scope of practice. This means that if you're a student, act as if you were already credentialed. You may order tests, administer medications, and give counsel as you would if you were working within your scope as a licensed professional. If you want to hear a heartbeat, breath sounds, or bowel sounds, listen with your stethoscope. If you want to give a medication or deliver oxygen, you need to actually perform these tasks on the mannequin, the same way you would for a real patient. You may also call for help that would be available to you in the actual clinical setting. Please don't pretend. In procedural simulation, you should complete the entire procedure as you would on an actual patient. Most of the task trainers and mannequins have very sophisticated features. Our full-scale mannequins blink, breathe, have chest rise and pulses, and may have IV access. The mannequins can talk to you, which you may find helpful in verbalizing physical findings or asking clarifying questions. Hybrid simulations may include a standardized patient paired with a task trainer. After every simulation, participants attend a debriefing session. The purpose of debriefing is to reflect on the case and share your thoughts. We encourage you to be honest during debriefing so we can improve the learning experience. Both observers and participants are expected to contribute to the debriefing. We ask that you keep all details of the simulation and debriefing confidential. We also pledge to keep the performance observed in the simulated setting confidential. We hope that your participation in healthcare simulation leads to effective learning and allows you to practice safer and more effective patient care. We expect that you may identify knowledge, skills, or attitudinal gaps which you can seek to fill on your own. We believe that learning in the simulated setting truly allows you to acquire knowledge that can change your world. We know that you will see some, sim some, harm none.